Why do some women develop cervical cancer even when they seem so healthy, but others never do develop it? Today, we'll be talking about the risk factors that are associated with the development of cervical cancer. My name is Dr. Stephen Kpatsi, and this is Ask the Oncologist. Now, what is a risk factor? A risk factor is something that increases one's chances of developing a particular disease. Having a risk factor does not automatically mean that you are going to develop the disease. Also remember that not having the risk factor does not automatically mean that you are never going to develop the disease. It just means that your chances of developing the disease is less compared to those who have the risk factors. When it comes to cervical cancer, it has well-known and well-documented risk factors, which, if you know, it empowers you and allows you to be able to direct your steps and reduce your chances of ever having to deal with cervical cancer. So stay with me and let's discuss these risk factors. The most important risk factor when it comes to the development of cervical cancer is infections with high-risk human papillomavirus. Human papillomavirus is a sexually transmitted virus, and it can stay unnoticed in the body. Human papillomavirus infections will often not give any symptoms, and because of that, most people never suspect that they have the infection. And we've realized that for people who have had the virus for a long time and it has not been cleared, usually for 15 to 20 years, they have a tendency to develop or to cause changes in the cervix that can develop into cancer. There are a number of human papillomaviruses, but there are some that are termed high-risk ones. These high-risk ones have been proven to cause cervical cancer. The two most important high-risk ones are 16 and 18. These two viruses alone are known to cause about 70% of cervical cancer cases. There are other ones that also cause the remaining ones, but these two cause most of the cases. The absence of HPV virus almost means no cervical cancer. Another important risk factor when it comes to the development of cervical cancer is early age at sexual activity. It is because when people start sexual activity at a very young age, their cervix at that point is still developing and is less mature, and this makes it more vulnerable to infections by HPV viruses. We often notice that people who have multiple sexual partners have a higher risk of developing cervical cancer. Now, when it comes to the number of sexual partners, it is not only about yourself, but if you have a partner who has other sexual partners, who has multiple sexual partners, this person or this individual can contract the virus from any of these other sexual partners and then bring it to the individual who supposedly has just one sexual partner. So having a partner with multiple sexual partners also increases your risk of contracting HPV virus, and in effect increases your chances of developing cervical cancer. Another important risk factor for the development of cervical cancer is smoking. In fact, smoking has been studied and it's known to double the risk of developing cervical cancer. Another thing about smoking is that it contains certain chemicals that we call carcinogens. These carcinogens generally increases one's chances of developing cancer. The presence of these substances in the cervical mucus impairs the ability of the cervix to be able to clear the HPV viruses, and hence the individual has a higher chance of having persistent HPV virus infections, and hence increases their risk of developing cervical cancer. Another key thing about smoking is that it weakens the immune system and in effect reduces one's chances of being able to fight against HPV viral infections, and hence increases their chances of having a persistent infection. A key risk factor is a weakened immune system. We've realized that individuals who have a weak immune system, for example, people who have been diagnosed with HIV infections, people who have undergone transplant and for which reason they have to be on steroids for a long time, tend to have a higher risk of developing cervical cancer. There are also some individuals who are on steroids for other reasons apart from having undergone a transplant. So the use of these steroids generally weakens the ability of the body to fight against infections, and hence increases the chances of having a persistent HPV virus infection and in effect the development of cervical cancer. Another critical risk factor is lack of screening. Because cervical cancer takes so many years to develop, often about 15 to 20 years, people who undergo frequent screening are able to detect precancerous lesions early enough and get them treated. And in effect, they almost never really present with a full-blown cervical cancer disease. So having regular screening is important. And if you've forgotten, this involves HPV testing, having a pap smear, or having colposcopy with a visual inspection with acetic acid. This helps to detect precancerous lesions and treat them ahead of time. Another key risk factor is not getting HPV vaccination. In fact, we know that more than 95% of cervical cancers are caused by human papilloma virus. So what this means is that when girls are vaccinated, they are able, when they are vaccinated early in life, they develop the immunity against HPV virus, and hence the chances of they contracting high-risk HPV virus and in effect having persistent infections are reduced, and hence their risk of developing cervical cancer is equally reduced as well. There has also been a small risk that's associated with the use of oral contraceptive pills for a long period of time. Let me quickly add that this risk is small, and most of the time the benefits of using the contraceptive pill often outweighs or often is bigger than the risk that is associated with in terms of the development of cervical cancer. So if you have any concerns, it's important to have a discussion with your healthcare provider so that you can make the best choice for yourself when it comes to contraception. We've also noticed that multiple full-term pregnancies tends to increase a woman's risk or chances of developing cervical cancer. This may be due to the hormonal changes that take place in pregnancy, and also the fact that the cervix has to undergo a lot of repair during pregnancy and delivery, especially if they do a vaginal delivery. So it's important to just have this at the back of your mind. But let me add that this is also a small risk factor compared to the other risk factors that I mentioned earlier on. What does not increase the risk of developing cervical cancer? Witchcraft does not, or is not proven to increase the risk of developing cervical cancer. Neither is a family curse, nor the usage of public toilets. Poor hygiene, these have not been proven to increase one's risk of developing cervical cancer. What can you do with this message that you've heard? Remember that getting vaccinated is very important and reduces the chances of one developing cervical cancer. It's also important to stop smoking because smoking has been associated with an increased risk. It's also key to remember that you have to have regular screening because not having cervical screening increases your chances of developing cervical cancer. And for people who have been diagnosed with HIV, it's important to get treated so as to keep your immune system active. And for people who have been diagnosed, remember to get early treatment so as to increase your chances of survival. Now remember that cervical cancer is one of the most preventable cancers that we know. And you understanding the risk should be empowering. It should not be frightening. If this video was of help to you, don't forget to share, subscribe to this channel so that you don't miss subsequent content. See you in my next video.